Mouth needs to have enough room for all the teeth to fit and for the tongue to fit and for the teeth to bite properly. And what you want to do is create the space so that everything has room to fit in there. If you go in there and you eliminate 4 adult teeth and use that space available to straighten the teeth, the net effect is going to reduce the space available in the mouth. And that has been shown, and I've seen it with my own 2 eyes, and I've had it done in my own mouth. What that does is it creates breathing issues, it creates clenching issues, and it creates issues with lack of tongue space and an uncomfortable bite. If you have someone who has a face full of teeth where they don't quite have enough face to fit the teeth, the answer isn't to remove their teeth. The answer is to get their jaw structure and face to grow so that all the teeth that were intended to be there can fit. If you go and remove teeth and shrink the jaws and face, that is going to result in a huge reduction in facial profile. And that's where we have some patients who come in years later after they've had these procedures done, and they'll say, Dr. Adams, what can I do to fix my recessed chin, my poor facial profile, my mouth breathing? Because if someone takes your jaws and brings them back so your tongue is closer to your throat, at that point your tongue is going to be occupying part of your throat space. And that's what actually causes all the breathing problems.